Dolores, now I'm done with assessment of your mouth. I'm going to tell you what I found, and after that I'm going to address your main chief complaint. Today you present with a lot of soft build-up on your teeth and moderate amount hard build-up on your teeth, mainly in the area between the contact of your teeth. Your gum don't look healthy. They show sign of gingivitis, which is a mild form of gum disease. I'm going to give you a mirror so you can see it yourself. See, Dolores, how your gum are inflamed, red and swollen, especially along the gum line. I put pink disclosing solution on your teeth which stick to plaque, and it helps to see area of teeth that you aren't brushing enough. As you can see, the area along the gum line have a lot of pink. This build-up we call dental plaque. It is sticky a film that form on teeth when bacteria in the mouth mix with sugary or starchy food. Now I show you picture. These bacteria produce an acid. When the acid stick to your teeth, it break down the enamel, setting the process of tooth decay. The same bacterial acid that destroy tooth enamel can start an infection of the gum tissue, which we call gingivitis. But gingivitis can progress into severe gum infection, which we call periodontitis, which cannot be cured and eventually leads to tooth loss. After you eat food is when most acid production occurs. So every time you eat meal or snack, your teeth are prone to plaque build up with a few minutes. Regular toothbrushing and flossing can get rid of plaque. But if the plaque is not removed, it's hardness into tartar, which we call decalculus. The more plaque adhere to your teeth, the more tartar that will form, which is much more difficult to remove. In fact, tartar can only be removed by dental hygienist. That is why it's so important to come see dental hygienist regularly. Fighting plaque by effective oral hygiene practice and regular dental visit is the most critical factor in protecting and preserving your teeth, gum for lifetime. Dolores, you said that you haven't been to the dentist in 5 years. But I'm so glad you are here today because gingivitis is totally reversible form of gum disease, and we caught it right on time before it progress into more advanced phase of gum disease, like periodontitis, which is non-reversible. I would like to show you what happens with periodontal disease. See, Dolores, here we have healthy tooth and gum tissue. The gum is very pink. It is healthy stage. Here we have a plaque. Plaque is comes inflammation around the teeth, and this stage gums become red, swollen, and bleed easily. And this stage we can call gingivitis. The next stage show us like periodontitis, and if you let plaque and tartar settle in the gum line and underneath your gum, bacterial toxins eventually start to attack the bone and ligaments surrounding your teeth. This stage is more advanced phase of gum disease. This person eventually will lose the tooth. Dolores, right now we have this stage, gingivitis. We will try to get back to first stage, healthy stage. If don't get gingivitis under control soon, it might be progress into periodontitis, what we try to avoid. Dolores, now I would like to show you very effective method of brushing that removes plaque. Dolores, hold the toothbrush parallel or your teeth. Tilt the brush to 45-degree angle so the bristles are slightly under the gum line. With a gentle pressure, brush back and forth, not pushing too hard, using a circular motion and flick down like this. Brush 15-20 times before moving to the next area. Don't forget to clean all surface for the teeth, especially the back side of the teeth, using the same motion. A lot of people don't even brush this area, and disclosing solution that I put your teeth show a lot of plaque accumulation in this area. When you brush lower teeth, brush away lower teeth. When you brush lower teeth, brush away towards the top teeth. The same motion. And when brushing the top teeth, brush down. When you brush the front teeth, a lot of people do like this. It's not ideal. Hold the toothbrush in a vertical position behind your front teeth and brush up and down in circular motion like this. It is important to brush all your teeth and all surface, including the outer, inner, and top surface of the teeth. Brush your teeth for at least 2 minutes. You can divide your mouth in 4 quadrants and brush each quadrant for at least 30 seconds. For example, 1 quadrant, second, third, and fourth. Dolores, now I would like to give you a toothbrush, and can you show me this toothbrushing method I just demonstrated, because I want to make sure you really know and remember how to brush your teeth correctly at home. Let's try it. Good job, Dolores. This is exactly how I want you to brush your teeth. It's possible to brush your teeth effectively with a manual toothbrush. However, scientists found that people who use an electric toothbrush have healthier gum, less tooth decay, and also keep their teeth for longer compared with those who use a manual toothbrush. Electric toothbrushes, especially those with head that rotated in both directions. And I'm going to show you how it used. Please hold the brush, not whole hand, please hold with 3 fingers. And hold the brush at 45-degree angle against your gum line, where the gums and teeth meet. And instead of moving in back and forth or in circle over the teeth, electric toothbrush simply need to be held gently against the tooth surface at the gum line to clean. When you choose to use an electric toothbrush or manual toothbrush, remember that what is most important is using the right brushing technique. And please brush all your teeth at least 2 to 3 minutes. This is current recommendation from the American Dental Association. And please make sure you change your toothbrush every 3 months, because after we brush our teeth, bacteria and plaque inhabit on our toothbrush. A lot of people don't know, but our tongue also harbor bacteria, which often leads to bad breath. Brushing your tongue gently from back to front a few times with a toothbrush and toothpaste, it is easiest first step, since you are already in the brushing your teeth twice a day anyway. This is special tool made for tongue scraper. Scraping can do a better job at removing the plaque and bacteria of the tongue's surface. How you are going to use it? You will stick your tongue out and apply light pressure to run the scraper across the entire surface of your tongue once or twice, starting all the way at the back of the tongue and scraping toward the front. It should not hurt or do any damage to your tongue. If it does, you are pressing too hard on the scraper. To use less pressure. At the end, rinse the scraper in warm water after each time and swish your mouth with water. You can see the toothbrush cannot get in between the teeth. So, flossing in between your teeth at least once a day is a must. When food gets stuck in these gaps, it creates ground for bacteria to build up, creating a plaque. Right now, I am going to show you how to properly floss in between your teeth. Flossing before brushing is the most efficient for removal of dental plaque. Break off about 18 inches of floss and wind most of around of your middle fingers and wield around the same finger on the opposite hand. Hold the floss tiny between your thumb and inner fingers. Guide the floss between your teeth using a gently rubbing motion. Never snap the floss into the gum like this. When the floss reaches the gum line, curve into a C shape on the tooth. Gently slide into the space between the gum and the tooth. C shape. Please use a clean side for each tooth. Repeat this method of the rest of your teeth. Don't forget the back side of your last tooth. And once you're finished, throw away the floss. Dolores, it's my favorite flosses. Please use that at least once a day before brushing. Please flossing every day. Megan, given the fact that Dolores has a plaque-induced gingivitis, which is an inflammatory response of the gingival tissue resulting from bacterial plaque accumulation located at the below the gingival margin, I choose to teach her both method of brushing because it is the most accepted and effective method for the removal of dental plaque. I choose dental floss, interdental tooth floss, because it is cheap, easy to use, and dental floss has ability to maneuver around any tooth, great for fitting into tiny spaces. I offer her to use a tongue scraper as a choice to control her bad breath. Also, what has been published so far describe tongue scraping as temporarily effective for bad breath. However, tongue scraper can help to eliminate not only harmful bacteria of tongue, which can help to prevent plaque and tartar buildup, cavity, as well as gum disease. I said, Dolores, that regular dental cleaning are essential part of good oral hygiene. Besides keeping the teeth and gums healthy, a regular dental cleaning allows your dentist to look what's going on with the teeth so that issue like cavity or gingivitis can be treated earlier. Tartar doesn't respond to brushing or flossing. Only dental hygiene can remove tartar from the teeth. And once this substance builds up of the teeth, the patient becomes susceptible to variety of oral disease.